Namaste and good afternoon. Welcome to a special FB Live session presented by Apollo Hospitals on the occasion of World Hepatitis Day. Dr. Srinidhi Chidambaram here. While COVID-19 remains the health topic that is foremost in our minds even now, we must remember that good health means that all the various organ systems in our body have to work without disease and in optimal condition. It is important to take care of ourselves and ward off various diseases and infections, and one such important one is hepatitis. Hepatitis is an inflammation of the liver, most commonly caused by a viral infection, and there are 5 main types of hepatitis viruses referred to as A, B, C, D, E. And these are of great concern because they cause a huge burden of illness and death, and there is a potential for outbreaks and epidemic spread too. Hepatitis B and C, in fact, kill more people annually than HIV, AIDS, malaria, and tuberculosis. Eliminating hepatitis B and hepatitis C as public health threats by 2030 would prevent approximately 36 million infections and save 10 million lives, they say. With a person dying every 30 seconds from a hepatitis-related illness, we can't wait to act on viral hepatitis. So hepatitis can't wait. And so let us understand about hepatitis today and make sure that we are well informed on what to do to prevent it and also to seek treatment early. Today, to talk to us on hepatitis and why it can't wait, I welcome Dr. Naveen Polavarapu, Head of the Department for Gastroenterology and Liver Transplant Services, Apollo Hospitals, Hyderabad. Dr. Naveen finished his MBBS from the NTR University of Health Sciences in 2001. He completed his MRCP, FRCP in gastroenterology from the Liverpool Deanery and further pursued advanced endoscopy fellowship training in ERCP and endoscopic ultrasound from the Aintree University Hospital. He further pursued his training in liver transplant fellowship at the Queen Elizabeth Hospital, Birmingham. He relocated back to India in 2014 and has been working at Apollo Hospitals and has converted or transformed the unit to a state-of-the-art endoscopy, 6 endoscopy suite with advanced procedures including cholangioscopy, therapeutic EUS, capsule endoscopy, manometry, and small bowel studies. He is spearheading the medical aspects of liver transplant and has done more than 400 liver transplants at Apollo Hyderabad itself with great outcomes. His main interests are in liver, pancreas, bile duct, transplant hepatology, complex gastrointestinal conditions, and advanced endoscopic procedures. Hello, Dr. Naveen.
Hello,
Thank you so much for participating today in our FB Live. So now over to you to begin with the basics of hepatitis and why it can't wait.
Yeah, thanks for giving this opportunity at the upfront. I think it's a very important day for all of us, and it's important to discuss about the much more overwhelming disease, which has been there for decades, but I think which is definitely is causing a lot of deaths and a lot of morbidities and problems to the general public.
Right.
And as you have mentioned, Dr. Srinidhi, that every 30 seconds, a patient dies or a person dies because of hepatitis. In fact, it is said that it is 5 times more dangerous than the HIV, malaria, or tuberculosis, for that matter. And that is the reason why I think it's important to know about this disease. And more importantly, what is astonishing is these are all preventable diseases. These are man-made diseases or preventable diseases. Control this, we can eradicate this. Therefore, we can save millions of lives in the future. And that's the reason why the World Health Organization in 2013-14 has decided to make 2030 as hepatitis-free world. And that's why they started this campaign. So every year on the July 28th, we celebrate the World Hepatitis Day to mark or make us aware of this condition, so that we can take all the precautions. It's a very simple treatments and the investigations that we can find out, which is very readily available. So with that, we can actually eradicate the virus for the future. So and in that way, we can save a lot of lives. Of course, we'll discuss about what is hepatitis and what does it do and how does it actually impact the liver. So probably we'll discuss in our further questions.
So going back to the basics, what is hepatitis? Because people often equate it with having jaundice, but what is the exact cause of hepatitis, and what are the different risk factors and so on?
Absolutely, it's a very important question. Anywhere itis means inflammation, and because it's happening in the liver, we call it as hepatitis. Okay? Often we associate hepatitis with virus, but there are 150 different reasons why liver can get affected, including some medications, drugs, particularly the medications we give for tuberculosis, for example. That can also impact liver functioning, cause inflammation. And along with this, the other important reasons that we see is the alcohol. The alcohol causes hepatitis, which can be quite dreadful. Along with this, what we're seeing a bigger elephant in our room these days is the non-alcoholic fatty liver. In other words, people who have diabetes, blood pressure, cholesterol issues, they have the fat deposit in the liver very quickly. And that fat in the liver causes inflammation. That inflammation over the number of years will lead to scarring, what we call fibrosis or scarring the liver. That scarring leads to what we call an irreversible permanent damage to the liver called cirrhosis. This is how the progression happens. So inflammation, when it happens constantly over a number of years, it turns to scarring, fibrosis. That leads to the cirrhosis. And once the liver reaches a stage of cirrhosis, it is an irreversible stage, as I mentioned. So from then on, all the complications develop. Like, for example, with advanced liver disease, patients present with swelling of the tummy, swelling of the legs, and they can get drowsy. They can have blood vomit. They can pass black stools. These are all the complications that we see once the patient develops the cirrhosis and its problems. So I told you about the common reasons, which is the alcohol and the fatty liver. But of course, the other important reason is the viral hepatitis, which is what we're going to discuss in detail today. So again, in viral hepatitis, there are different types of viruses: hepatitis A, B, C, D, E, as you mentioned earlier. And each virus has got different types of routes of transmission, and also, the damage that it does, severe liver damage. So we'll discuss probably in detail about all these viruses in our due course. But anywhere inflammation is called itis, and if it happens in the liver, that is hepatitis. The hepatitis, if it happens constant for a number of years, that leads to the cirrhosis or permanent damage.
Right. So what would be the mode of transmission for, or should we go by each one of them? Should we first talk about hepatitis A and then go on to each one? Or
yeah, sure, we can do that.
Yeah.
As we discussed so far, there are about 5 different viruses which have been identified. But of course, there are so many other viruses which can also affect liver, like, for example, cytomegalovirus and other different types of viruses. The common viruses that we discussed are the hepatitis A, B, C, D, and E. Okay? So if I had to split them based on the mode of transmission, hepatitis A and E, so A for apple and E for echo, these are generally transmitted by the contamination of the food poisoning or water contamination. So often we see that in patients who are having epidemics or where we get exposed to contaminated water, you can get this hepatitis A and E. A good thing about hepatitis A and E infections are most of them are self-limiting infections. In other words, as any of the viruses, most of them, they attack the liver, they cause inflammation, and as the liver and the body takes over that inflammation, the virus goes away. So most of these people recover themselves from this infection very quickly. But of course, very, very small proportion of these patients in hepatitis A and E infections, they can have liver failure. Once they develop liver failure, that can be acute liver failure, where some people may need even a liver transplantation. So which group they fall into, whether they recover or whether they will fall into deterioration, that the liver specialist will be able to advise based on that. So that's about hepatitis A and E. Now, hepatitis B and C are generally transmitted through various blood or body fluid contacts. fluid transmission. And generally, hepatitis B and C are the chronic infections. So whenever we say about viral hepatitis, often we discuss about these hepatitis B and C infections. Okay? Because as I said, hepatitis A and E are self-limiting infections. They cure by themselves. Whenever we talk about viral hepatitis, it is the B and C that we discuss. Now, B and C, most of them, as I said, are transmitted through the body fluid contact. What I mean by that is having infected blood products that can lead to the hepatitis B and C. And also having using infected razors, for example, or using infected brushes. Okay, these also can cause hepatitis B and C. And also through sexual transmission, particularly hepatitis B. In B, there's a risk of transmission through the sexual route also. And very occasionally, we can also get hepatitis B from mother to baby, what we call a vertical transmission. So mother is being infected with hepatitis B. There is a very high chance that the baby can also get hepatitis. So it is very important that all the pregnant women needs to be checked for their hepatitis B and C during their antenatal checkup. If that doesn't happen, you need to ask the doctors so that they get it checked. Okay, so these are general routes of transmission. Hepatitis B and C are transmitted through body fluid contact or blood transmission. Even sometimes with infected needles. So if you're using shared needles or people who are using drug abuse or infected needles, they can also get this hepatitis C particularly. And also in patients who are on dialysis, for example, hemodialysis, renal failure patients who actually go on dialysis. Through those filters, the hepatitis B can also, hepatitis C can also get transmitted. So it's very important that they use sterile filters, sterile needles, and making sure that there's no body fluid or blood fluid or the blood contact in these patients with hepatitis B and hepatitis D is generally seen in patients who have hepatitis D, and the mode of transmission is similar to hepatitis B. So we will not discuss much about D, but B and C are the primary ones which we generally talk
about. What would be the signs and symptoms of these types of hepatitis? What would be the earliest symptoms that one should be alert to?
Now, I think we come to the most important question, to be honest. See, these are silent killers. Hepatitis B and C. The reason why we're discussing today is because 9 out of 10 people who got been infected with hepatitis, they do not know that they have infection. They're suffering with this infection. They don't know because most of the time these are silent killers. Only when the liver has been damaged to an extent of cirrhosis, they would not have any symptoms. By then, as I discussed earlier, once they reach the stage of cirrhosis, it's a permanent, irreversible damage to the liver. Okay, so that's why it's important that we check for these viruses. Okay.
So for hepatitis B and C, so there's no symptoms. Then how does a person? I mean, is there some routine screening that they
Absolutely.
have?
Absolutely.
Or
most often, the patients who actually come to us saying I've been diagnosed hepatitis B is only when they do blood tests for another reason. For example, they're going for some surgery, and then when they did blood test, they picked up that they have hepatitis B or C. So, or they come for a master health check or a routine health check. That's when they found out that the liver test is slightly abnormal. Or if they do hepatitis B or C test, then they will pick up that they have the hepatitis B. So most often these are getting picked up these days because of another reason. So they get tests for other reasons. So if they do have symptoms, then generally they can have jaundice. They feel tired and lethargic. So they're very non-specific symptoms to a certain extent, which could be any number of causes, which can, or any other diseases can also present with tiredness. So there's no specific symptom that they actually say, look, this is a symptom, this is why I got hepatitis, and this is a symptom. So it won't be like that. Okay. So that is the reason why it is very important for all of us to get ourselves checked for this hepatitis B and C, so that we can get it treated when it is in the early stages.
Coming back to the ways in which signs and symptoms. So we spoke about how it being largely being asymptomatic. What kind of treatments are available for hepatitis B and C? Like if somebody is screened and found positive, you said that it's treated early. it can be uh, it can be resolved much better. So what happens if you don't treat it, and how do you really treat it?
Absolutely. So once, say, for example, a patient has been diagnosed with hepatitis B, then we assess the stage of the liver disease. So how much of the damage has happened to the liver, and what is the viral count, or how much of the viral load is there in the liver. Okay? So based on that, we can start the treatments. There are excellent treatments now where we can actually completely control the virus and minimize the damage that happens to the liver. Okay? And of course, for the hepatitis B, people are not infected with hepatitis B. There are excellent vaccinations which are available so that we prevent any further infections from the hepatitis. Okay? So for hepatitis B, there are excellent medications which will help in controlling the virus. And people who do not have hepatitis B, so if somebody is being diagnosed with hepatitis B, we always recommend that their close contacts, their family members, to be checked for this hepatitis B. Very important. And if they are negative, then we advise them to have vaccination so that they don't get contracted to the hepatitis. So for hepatitis C, again, we check the viral load and the damage that has happened to the liver. And I should say that hepatitis C is one of the success stories of the modern medicine, because if you look at this virus, by the way, was only diagnosed or discovered rather in 1990s. But till then, we didn't know there was hepatitis C.
Was this the one that used to be called the non-A, non-B?
Absolutely. Yes, absolutely.
That's
this was
yes.
True. In our days when we used to study, we used to call it as non-A, non-B. But 1990s is when it was actually diagnosed or labeled as hepatitis C. And this virus, initially, the treatments were very horrible treatments. In other words, they used to do a lot of injections called interferon, with a lot of side effects. And despite taking a lot of these injections, where the success rate or the chance of clearing the virus was only about 20 to 30%. This is what we used to have in 2010, 2012, to be honest. From 2014 onwards, we've been getting excellent drugs, which needs just one pill a day, just one tablet a day for 3 months. And there's a chance of clearing the virus is almost 98 to 100%. So you can completely eradicate this virus by taking this treatment, which is just one pill a day with absolutely very minimal side effects. A lot of people tolerate this medication without any problem. Just one pill a day, which will eradicate this virus. Now, the important thing about hepatitis C is most often this hepatitis C will lead to chronic infections. This chronic infection will lead to permanent damage called cirrhosis. And in fact, as of now, the most common reason why people develop liver cancer and also the liver transplantation, people go for liver transplantation, the most common indication now is hepatitis C.
Right.
So hepatitis C is a very dreadful virus. It is a carcinogenic virus, or in other words, it is a cancer-forming virus which sits in the liver and damages the liver. For that, what I'm saying is there are excellent treatments where there is a 100% chance of completely curing the virus. Therefore, you're going to minimize the risk of damage to the liver. You're going to minimize the risk of developing cirrhosis and also the liver cancer. Just by taking one pill a day for 3 months or 12 weeks, you can completely eradicate the virus.
So we have now spoken about the treatments, and so now the other important aspect is the vaccines. Now we keep hearing about the hepatitis vaccine, but could you clarify to our viewers on what are the vaccines that are currently recommended in India for people to take, like, which are part of the immunization schedule, and are there any for example, even for the pregnant women, like, which are the vaccines, are they supposed to take anything? So if you can just give us some idea about the vaccines for the different types of hepatitis.
Absolutely. Another important question, because vaccination is, prevention is always better than cure. So before you get the infections or the disease, always better to get ourselves prevented from the infections. And vaccines by far are the best way of, or the tools which can prevent us from any infections. Having said that, I'll just tell you upfront that for hepatitis C, C for Charlie, there are no vaccines available yet. But as I told you earlier, there are excellent medications which are available to completely cure the hepatitis C. Now, the vaccines which are available for hepatitis are generally hepatitis A and B viruses. So whenever we talk about hepatitis vaccinations, we generally discuss about hepatitis B vaccination. Okay, and in fact, the Universal Child Immunization Program has started doing the hepatitis B for a while now. So everybody who's born recently after 2000, they've been getting universal hepatitis B vaccination. Okay, the vaccination schedule is very simple. You take one dose today, you take the second dose in a month's time, and the third dose in 6 months' time. So every child and adult will get these 3 doses for the vaccine. So this is a universal World Health Organization WHO recommended vaccination schedule. So very simple, straightforward injections with very minimal, but with no side effects, to be honest. Very straightforward. And it's a dead virus only, so it should not cause any infections. Okay, so hepatitis B, 3 vaccinations, everybody should get vaccinated. All the health workers or people who are at high risk, or people who are going for dialysis, for example, who are at risk of getting exposed to the hepatitis, all of them should and will get vaccinated. Okay, all of our health workers are vaccinated for the same reason, because we are high risk people. But what I would suggest, I hope I can communicate this message to the rest of the public, that everybody in this world should get vaccinated to prevent the infection. Okay, not necessarily only the high risk people. Everybody is at risk. Everybody is at risk, and everybody should get vaccinated. And the success of the vaccination or the protection you get is excellent. There's a very, very, very minimal chance that you can get the virus again after getting vaccinated. So it's an excellent tool or a shield for you to prevent from getting this vaccine. From getting this disease.
Absolutely. And what about the hepatitis A? There is a vaccine for
Yes,
that.
there is a vaccination. There are 2 types of yeah. So again, hepatitis A is the most often self-limiting infections. So yes, you can get vaccinated, especially in high-risk population that we think. It's basically a single dose. Sometimes we give 2 doses also. Sometimes we combine that with hepatitis B also, hepatitis A. And you also get lifelong immunity with this hepatitis A infections. But I think the most important point which I want to drive is the hepatitis B vaccination, that everybody should get hepatitis B, because this is a condition where the liver will invariably get affected and will lead to liver cancer. In fact, the other statistics which shows that at least 350 crore population in the world is affected because of hepatitis B. It's 350 crore, which is like almost 2.5 times the population of Indian population. So of the world is affected with hepatitis B and C. And along with hepatitis C, hepatitis B is one of the most common reasons why people get liver cancer. When you have hepatitis B, your risk of developing cancer goes up by 100 times compared to a person who doesn't have hepatitis B. So the risk of cancer goes up significantly. The risk of liver cirrhosis goes up significantly if you have hepatitis B and C infections.
So the hepatitis C vaccine is not available, you were saying that. So is it available in other parts of the world, or
no? It's not been made yet. It's hepatitis C is very difficult to actually to cultivate the vaccine because of its RNA structure itself. It's very difficult. Similar to like what we have in HIV RNA virus. So it's difficult to because of the liver transcriptase pattern and stuff. So it's very difficult to make a vaccine for these kind of RNA viruses.
So will the hepatitis B vaccine protect you against the C also, or it doesn't work?
No, it doesn't work that way. So hepatitis B vaccination only protects for hepatitis B. But as I said, everybody should take all the precautions to not get hepatitis C. As I said, people are high risk. Hemodialysis, for example, they should make sure that their filters are not reusable. They are only use and throw. Single-use filters are used. When you're using needles for injections, make sure it's a sterile needle that you're using. Okay, and also making sure that any kind of procedures that they need to be sterile. And other very important point is get yourself checked for hepatitis C. It is there in the community. A lot of people are actually, when we did this survey for these patients, we run a Save the Liver Foundation trust, and through that Save the Liver Foundation trust, we actually did a mass campaigning both in Andhra Pradesh, Telangana, in fact in Karnataka also. In that we actually did screen for a lot of patients, about 80,000 people that we screened, And there are a lot of pockets, both in AP and Telangana, where the prevalence or the risk of having this hepatitis C is almost 8 to 10%, compared to about 2% in the rest of the Indian population. So there are pockets where there's very high incidence of this hepatitis B and C. The reason why we did this kind of a campaign is because I had few patients, about 6 patients from one community who came to us with either cirrhosis and liver cancer. So then we started looking at where they came from, where they originated from, and then when we actually checked in that community, they had more than 10% population which been infected with hepatitis C. That led to this campaign that we did, and we completed about 80,000 patients population, and pickup rate has been very high in particular areas.
I think there is not much information out there about hepatitis C in the community. I think, through the great work of people like you and through other community initiatives, I think not many people ever think about hepatitis C or anything like that. So I think that information and awareness has to definitely spread. I also, before we go on to questions which are coming to us on the live feed, I just wanted to ask you about vaccinations for the pregnant women in our country and also about hepatitis in children.
So hepatitis in children has come down quite dramatically these days because of the vaccination that happens universal program of vaccination. And in fact, there was one big study which was done in China. They looked at people who've been vaccinated, who not been vaccinated. That's in fact how this vaccination schedule was incorporated by the WHO. And the risk of liver cancer in particular group, particularly in China and in Tibet area, was very high. As I said, liver cancer risk was very high, and that is how they picked up that, look, this is a virus which is causing cancer, we need to control it, and that's how they started vaccination. They have seen a dramatic improvement in terms of reduction of the liver cancers in that population. And that's how the program of vaccination started. And as I said, all the children now with the universal vaccination program will be vaccinated for the hepatitis B virus. Now, pregnant women, yes, we need to check for them for the hepatitis B. And then if they are, you can take even the vaccination during the pregnancy also. There's absolutely no contraindication. As I said, it is a dead virus. It's a dead virus. So there's absolutely no problem in taking the vaccination for the pregnant. And as I said earlier, blanket rule is everybody in this world should be vaccinated for the hepatitis B to prevent that infection. Okay, so even the
sure, please go on. Yes.
Yeah.
No, please go on.
Yeah. So the risk of this infection causing damage to liver goes up when you get infected at a very early age, and that is the reason why people who get transmitted from the mother to babies, which means they were born with the virus, their risk of developing cancer is very high as they get older. Okay, so it's very important that we vaccinate all of them at a very early age so that we minimize the progression of the
what I wanted to ask you was that if a woman is pregnant and during the antenatal screening, if she is positive for hepatitis B, what is the protocol that is followed?
Yeah. It's another important question. We have a gynecology led services in our Apollo hospitals here, and we get a lot of patients with hepatitis B infection which got picked up during the antenatal. So as I said earlier, all these hepatitis gets picked up for tests for other reasons, like in pregnancy or for other master health check and stuff like that. So when a pregnant lady comes to us with hepatitis, we assess the liver severity at that point and also the viral load. Okay, the risk of transmission from the mother to the baby is much higher during the delivery time. Okay, whether it's a normal delivery or whether it's a cesarean delivery, the risk is still the same. Now, when the baby is in the uterus, which is connected to the placenta, the baby is safe because this virus does not get transmitted through the placenta. Okay, so there's the transmission that happens is only during the delivery time, not during the pregnancy time. So if you if you have a very high viral load, a mother has got very high viral load, then we give medications in the last trimester of the pregnancy so that we reduce the risk of transmission to the baby. Okay? Because as I said, the virus does not get transmitted to the baby through the placenta. It is only during the delivery time, whether it is to the normal natural vaginal delivery or to the cesarean. That's where when the blood-to-blood contact between the mother and the baby happens, and that's when the transmission happens. So if you actually give the mother viral load and reduce the antivirals or the medications reduce the viral load, then risk of transmission is going to be very minimal.
Absolutely.
And also, sorry, another important point is the baby, what we give immediately after delivery is there are certain injections called immunoglobulins. Immunoglobulins are like the soldiers of the body, which protect us from the infection. So we actually arm the baby with the immunoglobulins so that they can fight the infection out very quickly before the vaccination starts kicking.
So, Doctor, now we will go through the questions which are coming to us from our viewers. The first one is there a vaccine that will protect me from both hepatitis A and B?
Yeah, of course, there are vaccinations as well. So both for hepatitis A and B, certainly there are excellent vaccinations which give good protection. Previously, every 5 years after hepatitis B, we used to take booster doses. Okay. Now the vaccinations are so effective that the WHO does not recommend to get any booster dose. All you need to do is just take 3 doses of the vaccination and you'll be fine for the rest of your life.
Perhaps what they mean is there some combined vaccine
Yes.
for A and B?
Yeah, there is a combined vaccination for both A and B. Yes, it is available. It's available in the market. Yeah.
Okay. How long does the hepatitis B virus survive outside the body?
Good question. Hepatitis B virus is a very resistant virus. Sometimes it can, even in the normal temperature, they can last for up to 24 to 48 hours in the normal temperature. So yes, you can get infected with, if there's a very high viral load, then it can stay in the environment for about 24 to 48 hours.
Can hepatitis B spread through food?
No, it doesn't get spread through food. It is only through the body fluid contact or primarily through blood transmission. That's where it gets transmitted. Often the most common route is a blood-to-blood transfusion or the blood contact or sexual transmission. These are the 2 common routes that we see. And as I said earlier, that is the reason why I said in the earlier part of our discussion that people who got hepatitis B, we should make sure that they don't share their razors or brushes, because sometimes you can have gum bleeding and that can get attached onto the brushes of the brush, bristles of the brush, and then if you actually use that, you may be at risk of developing it. People with hepatitis B, when they get cut or any kind of a scar, any bleeding, they should make sure that they cover it very quickly so that they don't expose the blood to another person. So it's basically primarily blood-to-blood contact which we need to prevent in hepatitis B. It does not get transmitted through food. Often the other question we get asked in our clinic is, can I sleep on the same bed with people who are infected? Can I use the same bed sheets? Can I use the same utensils? That's absolutely fine, no problem with all of them. The only thing you need to think about is make sure you don't have any blood-to-blood contact.
How should blood spills be cleaned from surfaces so that the hepatitis B virus is gone?
Another important question. So any detergent will be able to kill hepatitis. These are not resistant viruses, but they actually stay in the normal temperature for a while, but they get very cleaned or they get killed with normal detergent. Soap and detergent is absolutely fine. You don't need to use any special cleaning solutions for this.
Post-COVID, during the recovery phase, due to high steroid usage, is there a possibility that we can get hepatitis or liver disease?
Excellent question. We are seeing an increased number of all these viruses, not necessarily hepatitis B only. We're seeing so many other opportunistic infections which actually stay in our body without causing any infections. When you give steroids and reduce immunity, all these infections are getting flared up, and we are seeing increasing number of these kind of viruses. Now, hepatitis B and C are chronic infections, as I said, so it is possible that they are going to cause more damage to the liver in the future. But the problem is, because these are silent killers, and until it causes significant amount of damage and have symptoms, people don't come to a clinic. So that's a problem with the hepatitis B and C. But yes, definitely there's an increased risk of these viruses getting activated, flared up after taking these steroid medications.
Right.
In fact, that raises another important point that people with who have got cancers or lymphomas or any type of cancer, or if you give any particular drugs or chemotherapies for these kind of patients, we always start them on the antivirals before we actually give a chemotherapy. The reason why we do that is with the chemotherapy and other drugs, we will reduce the immunity and therefore this virus can get reactivated. So even if you have the HBsAg or the surface antigen, which is a normal standard test that we check for hepatitis B, even if it is negative, there can be a virus sitting still in the liver cells. The notorious thing about hepatitis B is even though you can clear the virus, the DNA of the virus gets attached to the liver cells. What we call the cccDNA of the virus attached to the liver cells. So that is a problem with hepatitis B, that will not be able to completely remove it and once you have an infection. Okay, so all the treatments that we have is to control the infection but not to completely eradicate for the hepatitis B.
Right. This is a question about somebody who says they have a smell of blood in their breath. They can smell it, and whether it is something that they need to check with the doctor.
Interesting. I think you probably should get checked if they smell the blood. I hope they're not having any blood vomit or any passing any black stools. So blood, when it comes out through the back passage, when it transits through the intestine, it turns into black. Certainly, if they're having any black stools or if they have any kind of blood vomit, or then they need to get checked. But yes, I think if they're having anything abnormal sensation, they should definitely get themselves checked.
Can a person spread the hepatitis B without having any symptoms?
Yes, absolutely. That is why I'm, that's what we're discussing, and it's a silent killer. And we see so many, people and so many contacts who may not be knowing that they have hepatitis B. As I said, 9 out of 10 do not even know that they have hepatitis B. Okay, and when you actually use when you go to a barber shop or salon, if you use the shared, the blades or the razors, then you can get infected through that. And even through body fluid contact, sometimes it can get spread, especially if they have a very high viral load. Okay, so yes, it is very much possible that they can spread the virus without not knowing it. And that is the reason why I keep saying that everybody should be vaccinated. It is not only just the high risk population, everybody in this world should be vaccinated so that we can prevent the spread of this virus.
Sure. So thank you so much, Dr. Naveen, for this wonderful discussion. And we had a lot of questions, and this was I hope that the message is really gone across, that people must be aware of hepatitis B particularly, and definitely get universally vaccinated. Thank you so much, and thank you viewers for joining us today. Please subscribe to our YouTube channel too, because there's a lot of interesting videos on the latest health information. And till we meet again, do get all safety precautions in place as far as hepatitis goes, and practice a safe lifestyle, and always be alert and aware, and do get vaccinated. See you soon. Thank you and namaste.